I thank Ms. Martha Sánchez Nestor, Alianza de Mujeres Indígenas de Centroamérica y México. I now give the floor to Mr. Mario Ottiglio, International Federation of Pharmaceutical Manufacturers Association. Mr. Ottiglio is Associate Director, Public Affairs at the International Federation of Pharmaceutical Manufacturers and Associations, IFPMA. Based in Geneva, Mario leads IFPMA's advocacy on global health issues, coordinating interactions with the most relevant stakeholders, including governments, UN agencies, civil society, and health professionals. Mario, an Italian national, holds a master's degree in political science. Mr. Ottiglio, you have the floor.
Thank you, Madam Chair. Madam Chair, Your Excellencies, ladies and gentlemen, on behalf of the International Federation of Pharmaceutical Manufacturers and Association, I would really like to thank you for the opportunity to contribute to this hearing to explain our sector experiences and lessons learned from partnerships to fight against poverty and poor health since 2000. We support the Secretary General's call for a global action agenda for accelerating progress towards achieving the Millennium Development Goals by 2015. The IFPMA represents the global innovative pharmaceutical industry whose primary contribution to global health is the research and development of innovative medicines and vaccines. Our members comprise leading international biopharmaceutical companies as well as national and regional industry associations in both developed and developing countries. Thanks to innovation, the lifeblood of our industry, our members have developed the vast majority of essential medicines as defined by the World Health Organization. Sustained innovation remains critically important because of the unmet medical needs, because of the emergence of new infectious diseases and the development of resistance by diseases to existing treatment. A supportive intellectual property environment is essential to encourage biomedical innovation. Increasing access to medicine while respecting intellectual property rights are not mutually exclusive concepts, but they are rather mutually supportive. Madam Chair, first and foremost, I want to reaffirm the innovative pharmaceutical industry's commitment to help achieving the MDGs, and with particular reference to numbers 4, 5, 6, and 8. While the IFPMA has documented contribution towards all the health-related MDGs, I would like to highlight at this hearing goal number 8, and specifically its target 8E, calling for cooperation with pharmaceutical companies to provide access to affordable essential drugs in developing countries, as this target specifically applies to my organization and its members. The factors that create the current unsatisfactory state of health for many people living in the poorest countries are complex. While states have the primary responsibility to improve global health, the innovative pharmaceutical industry plays a unique role. We research, we develop innovative, safe and effective medicines. Moreover, in the developing countries, our industry works to reduce mortality and morbidity through multi-stakeholder dialogue and philanthropic partnerships, through donation or a non-for-profit basis or reduced profit basis, cognizant that commercial organizations need to reflect the concern of various different stakeholders. Between 2000 and 2007, to say the halfway mark for the MDGs, IFPMA members have made nearly $10 billion worth of health assistance for access and capacity building in developing countries, and over $1.3 billion public health intervention. We have a strong track record of public-private partnership to improve health in developing countries, working with governments, with international agencies, with civil society, with faith-based groups, academic institutions, and communities. We publish annually the Developing World Health Partnership Directory, which catalogues the broad range of active philanthropic and non-for-profit programs that our industry is undertaking. The current edition documents 213 programs. That is a 5-fold increase if compared to the number of projects first recorded in 2003. These programs have contributed to research and develop new affordable medicines, to prevent and combat neglected diseases, to build healthcare capacity, and also introduce health services in remote areas where they were lacking, but also to increase immunization capacity, to enable local production of high-quality medicine, to share knowledge and expertise in developing countries. These programs demonstrate how effective partnership and accountability framework between civil society, the private sector, local authorities, and national governments can promote more equitable, inclusive, and sustainable development. IFPMA members represent collectively the third largest funders of research and development for diseases of the developing world, and increasingly companies share their compound libraries and their scientific acumen with research partners, including those in the developing countries. While in the past 5 years our efforts in research and development for medicine for neglected diseases have dramatically increased, these efforts are progressively more collaborative. Our members indeed work with specialized product development partnership in about 2/3 of such projects. These partnerships show how market failure can be overcome to undertake R&D for vaccines, diagnostics, and drugs for diseases of the developing world. By using public and philanthropic funds, these revolutionary paradigms engage the pharmaceutical industry and academic research institutions in efforts that would normally be unable or unwilling to pursue independently without additional incentives. We share the sense of urgency expressed by the United Nations, which against the backdrop of a global economic crisis affirms that, and I quote, the need to accelerate delivery on NDG aid commitments and urges that this has now become an emergency rather than a simple matter for urgency. Our members will continue to strive to improve and create new partnerships that enable each stakeholder to use its expertise in a concerted manner, thereby making the joint effort an effective, far-reaching and beneficial undertaking for patients in developing countries who benefit from the products or services of these partnerships. This is a part of a long-term effort. We can be encouraged by the fact that our projects have been sustained through the economic downturn. However, Madam Chair, we are conscious that as one sector of private industry, we cannot do this alone because of the complexity of the challenges that we are facing nowadays in global health. And particularly in the developing world, these challenges are beyond the capability of any single stakeholder. We have learned that one size does not fit all, and that we need diverse models of collaboration tailored to the resources of different sets of partners. Communities which are the most directly affected should determine their own needs and priorities. This is key to building capacity and ensuring sustainability. Effective multi-stakeholder cooperation should be ambitious in its reach. For example, access partnerships and drug donation programs have raised the profile of the diseases, have kick-started the National Disease Control Program, and also improved delivery systems. To accelerate the progress towards the achievement of all the Millennium Development Goals by 2015 and to provide the necessary conditions to scale up the experience gained through 10 years of partnership, we encourage strengthening of healthcare system across the developing world, predictable and sustainable financing mechanisms, reduction of add-on costs of medicine along the supply chain, and for more effective multi-stakeholder cooperation that reaches the largest portion of population in needs. Madam Chair and colleagues, the WHO Director General said that while we have powerful interventions for reaching the health-related MDGs, what we lack are the system for delivering these interventions to those in greatest needs on an adequate scale and on time. We could not agree more. Weak and fragmented health systems, inadequate resources, as well as a serious shortage of doctors, nurses, and pharmacists are obvious barriers to access to healthcare. Any improvement made today will strengthen the ability of countries to develop sustainable systems that can meet tomorrow's challenges. Efforts should also be devoted to the regulatory arena through harmonization, mutual recognition, and safeguarding of high-quality standards. This means, Madam Chair, that the role of the governments is here fundamental. Compounding these shortcomings, some factor can also inflate unnecessarily the cost of essential medicines, particularly in the least developed countries. Most of our members have put in place and are further exploring a range of pricing approaches such as tiered and preferential pricing to balance commercial objectives with the need to increase access to medicine for patients in the poorest communities. That is the goal on which every one of us in this room is working for. For most health issues, it is rarely high-tech solutions, but rather primary care interventions that are needed. And to conclude, building on the foundation of the MDG actions to date, we do need to make clear priorities, recognizing that no one of us can do everything. The innovative pharmaceutical industry shall continue to provide the global community with products from its research and development, access initiatives to enable uptake of these, as well as technical and scientific capacity building and educational programs. Success for the innovative pharmaceutical industry is built on a long-term, high-risk investment that delivers medicines to patients wherever they are. It's a challenging, it's a long process, but we make it work, and we will continue to do so. Achieving the MDGs requires the same dedication and commitment, and our partners today and in the future can count on our dedication to improving global health. Thank you.
I thank Mr. Mario Ottiglio of the International Federation of Pharmaceutical Manufacturers Association. I now give the floor to Ms.